Good day, Ma'am and Sir. I'm Kurt Casado from DSM-13C, and for today's video, I'll be demonstrating on assisting ambulation without aid. Reviews medical record for patient's most recent activity experience, record weight. This is to have a baseline pertaining to the patient's overall physical capabilities. So the medical record of the patient shows that the patient was able to tolerate a recent activity. Current weight of the patient is around 30 kg. Number 2, reviews medical record for history of risk of orthostatic hypotension. This is to determine whether the patient can maintain hemodynamic stability. Medical history of the patient shows that the right sided weakness with no signs of hypertension. Number 3, reviews healthcare provider's order for activity, notes for mobility, or weight-bearing restrictions. This is to facilitate ambulation within the parameters of the attending physician. Doctor's order to ambulate patient once a day, preferably in the morning. The patient is able to move both lower extremities with considerations of weak-sided weakness of the right lower leg. As per doctor's order, the best time to ambulate the patient is morning and after breakfast. This is to have patient energy during ambulation. Number 4, determine best time to ambulate, schedules around activities. Every patient is unique in which time of the day they are most physical capable. Number 5, checks patient environment for barriers of safety risk. This is to promote safety during ambulation. Patient environment is safe. Number 6, identify patient using at least 2 patient identifiers. This is to ensure that ambulation activity is being facilitated on the appropriate patient. Good morning, ma'am. Ako rin si Kurt Rosete, yung student nurse today. Isa yung name, ma'am?
Kia James Ite,
Birthday?
August 14.
Sige, thank you, ma'am. Magkuha rin ito vital signs ni mo, ma'am. Imong BP, imong temperature, o straight. Sige, matansa to sa ilok, ma'am. Assess the patient's readiness to ambulate. Number 8, assess the baseline vitals. This is to ensure hemodynamic stability prior to ambulation. Number 7, perform hand hygiene. This is to deter the spread of microorganisms. Ma'am, nari kay pabuhat sa imuha, ma'am, ha? Palihog na kong sa kaan nga tiin, ma'am. Pikas, ma'am. Tapos kani, ma'am, ato ang ipiko, ma'am. Pasaka. Pikas. Nga, ituyok na to, ma'am. Okay, pikas. Sige, ma'am, mag-apply din ko pressure gamay, ma'am, ha? Basta isa ka ni multi-L. Sige, isa ka, ma'am. Pikas, ma'am. Assesses the range of motion and muscle strength of lower extremities. In bed if necessary. This is to determine whether the patient can tolerate the ambulation activity. As if the patient is tired or experiencing pain, determine source of and severity of pain, administer analgesic if necessary. This is to promote comfort, relieve anxiety, and to assess readiness for ambulation. Assesses the patient for any deficit that may affect his or her ability to follow instructions. This is done to minimize the probability of injury. Places chair or wheelchair nearby if necessary. This is to provide respite to the patient in the event that he or she can no longer tolerate the ambulation activity. Assist patient from a supine position to the side of the bed. Number 15. Raises the head of the bed, places the bed in low position, places non-skid footwear on patient. Raising the head allows improved circulation to the lower extremities. Number 16. Stands on appropriate side of the bed, turns patient on the side of the facing self. This is done to prepare the patient for sitting position. Number 17. Stands opposite patient hips, turns to face the patient on the side facing self. This is to prepare and assisting the patient to sit down. Number 18. Place feet in wide base of support. This is to facilitate proper body mechanics and prevent lower back injury. Magtaot ko sa sapatos din mo ma'am ha para kunya sa tong procedure kay dili ka ma-slide. Sige ka dali ka kayo. Sir, ikuan ang sa side sir ha para makalingkod ka. Sige, side ta sir. Ma'am, ipiko na ito dali ma'am. Then, saka ta ma'am ha. Ihap ko 3 ma'am. Pag 3 ma'am, masabay ka. Sige, 1, 2, 3. Naripong ka ma'am, wala. Wala. Ma'am, iniyapiyas mo na ito ang tiil ma'am para dili ka mabigla ma'am ha. Exercise na to. Number 19. Places arm properly under the patient's shoulder, places the other arm around patient thigh. This is to provide support as the patient initiates to sit. Moves patient's leg and feet over side of bed, pivots weight to allow patient's upper leg to swing down, elevates patient trunk to upright position. Number 21. Allow patient to sit for a few minutes, flexes and extend patient's feet and move legs up and down, checks blood pressure if necessary, have patient relax and breathe if he or she feels dizzy, return the patient on bed if necessary, applies gait belt appropriately, holds belt properly. Once patient stands, gait belts allow healthcare professionals to provide more support as the patient stands and ambulates. Helps the patient to stand position with shoulders back, assesses ability to bear weight and balance. This is to determine whether client can tolerate ambulation. Returns the patient to bed or chair immediately if he or she is unsteady. Obtain additional help. This is to prevent injury and to promote safety. Places IV pole on the side of the infusion. Instruct the client to push the IV pole while walking. Promotes coordination. Magbutang dahil kong gate, sir, ha? Ay, ma'am. Ma'am, kunit sa akong likod, ma'am. Kaya, ha? Number 26. Empties the drainage bag if necessary. This is to ensure that the bag is carried appropriately and there is no tension on the tubing. This minimizes the risk of spilling the contents from the bag. Number 27. Decides with patient how far to ambulate. This is to set a goal and to provide focus and motivation to the patient. Stands on appropriate side of the patient, slightly behind. Grabs the gait belt, supports patient appropriately through the first few steps. Ma'am, magkanila ma'am ha, mag-assist na ma'am. Wala lang kanalipong ma'am, no? Sige ma'am. Ganito yung week. Kanina yung week ni mo ma'am, no? Mo ano yung ilakaw ma'am. Sige ma'am, lakaw ma'am. Isa ra ka. Ay, ilakaw ka itong dali. Mo ilakaw. Isa ma'am. Assesses the strength and balance before continuing. This is to ensure that the patient can truly tolerate ambulation, position patients between self and wall, encourage the use of handrails, observe how the patient walks, evaluates activity intolerance. This is, the patient's gait can provide clues to his or her overall wellness. Evaluating activity tolerance ensures that the patient does not exert himself or herself. During ambulation, ma'am, may maglakaw na dahil ma'am ha. Ito dito, tas may ano ma'am. Kana-unahan na to ma'am, sige ma'am. Sige. Ayan ma'am. Reacts if patient starts to fall. Number 33, grabs gait belt with both hands. This is to prevent the impact of the patient from dropping to the ground. Number 34, stands with feet apart for support. This lowers your center of gravity, providing much needed balance to the healthcare provider to support the patient. Pulls patients against self, slides patients down legs slowly to the floor, does not risk personal injury. Bend knees and lowers body with the patient. This lowers the center of gravity and promotes proper body mechanics. Number 37, stay with the patient until help arrives. This is to provide physical and psychosocial support. Number 38, returns patient to comfortable position in bed or chair, performs hand hygiene. This is to promote comfort, prevents injury and spread of infection. Infection to the patient.
Likong ko sir.
Sige ma'am. Performs hand hygiene. Number 39, records time and distance ambulated, changes in vital signs, and patient tolerance in the patient chart. This is to ensure precise documentation. This data can be used as a baseline for future ambulation exercises.